So I saw a woman recently who had had a hysterectomy for uterine prolapse. She had had a drop of her uterus and she felt fine. But then when I saw her recently, she actually started to notice a vaginal bulge again. She was starting to feel that she had to lean forward, to lean back to empty her bladder or have a bowel movement. After she's emptied her bladder or had a bowel movement, she didn't feel she had completely finished. She had to push and strain a lot or start to actually notice a bulge that she had to push up in the vagina to help to empty her bladder. She was starting to notice more pressure, pain with intercourse was becoming more painful. She had to stop exercising. All of these things started to happen when she noticed this vaginal bulge. She was so really surprised because she said, oh, I had a uterine prolapse. I had a hysterectomy. Now, what am I now feeling, doctor? Well, when I examined her, assessed her, realized she now had vaginal prolapse. And it is a condition that happens quite frequently. And in this video, we're going to talk about why it happens, how it happens, and 3 ways to fix it. Dr. Tugbiyele, board certified fellowship trained urogynecologist, top doctor of urogynecology. And I've seen thousands of women over the years with prolapse. And particularly, I've seen a lot of women with a vaginal prolapse, particularly women who've had hysterectomy perhaps for uterine prolapse and then developed a vaginal prolapse. And so uterine prolapse or vaginal prolapse is very common. If you're a woman listening to me right now with, you either had your uterus and you've noticed your uterus has dropped, or you've had a hysterectomy and you notice that now you have a vaginal prolapse, know that you're not alone. It's very common. There are a lot of safe and effective solutions to improve your quality of life, comfort, confidence, and control, so you don't have to live or put up with it. And so in this video, we're going to talk about 3 solutions to fixing prolapse, particularly a vaginal prolapse. And so in this woman with a vaginal prolapse, I'll show you this picture. She initially had what we call a uterine prolapse. And so this is the front and the back. We're looking at a woman from the side, and this is a woman's uterus. The uterus is actually supposed to be way up higher, but as you can see here, it's actually dropped down towards the vagina, and that's called a uterine prolapse. And in a woman who has had a vaginal prolapse, the way that looks is, so the uterus is no longer there. A woman's uterus was once upon a time here. It's front and back, pubic bone, tailbone, vagina's in the middle, bladder's here, rectum's here. The uterus was once upon a time here. When a woman has a hysterectomy, the uterus is removed, and the vagina, if it's to drop in the future, it actually drops down, as you can see in this picture, where the vagina is no longer up here. It's actually dropped down. And just like the woman I described, when the vagina drops, the bladder and the rectum can follow there. So, a uterine prolapse or a vaginal prolapse occurs in more women who have had children, particularly women who've had children vaginally. It's more common in women who have had difficult vaginal deliveries, maybe a big baby, as well as women who have a history of heavy lifting and constipation. It's more common with age because of the decrease in hormone levels that can cause the tissues not to be as supported well. And a lot of women will notice prolapse of the vagina and the uterus when it comes to constipation, or women who carry a more excessive weight that can cause more pressure on the pelvic floor. With a uterine prolapse or a vaginal prolapse, women will feel that pressure, that bulge vaginally, that can then start to affect bladder, peeing, and emptying the bowels, having a bowel movement. Why? Because that pressure in the middle actually starts to drag the bladder and or rectum down, which can affect how a woman empties her bladder or bowel. Not to mention, intercourse may become uncomfortable, exercise may become uncomfortable. It affects different areas of a woman's quality of life. During an exam, we measure the prolapse and grade it. We have a grading system that grades the prolapse. When the prolapse is halfway in the vagina or has just begun, we call that a grade 1. When that prolapse is at the opening to the vagina, where now a bulge is felt, either when the uterus is there, women will feel their cervix there, or if it's a vaginal prolapse, if a woman's had a hysterectomy and the uterus is no longer there, they may feel a bulge, which is the vagina and the bladder. That's a grade 2, and that's when it's kind of moderate. And then grade 3 is when the prolapse actually protrudes outside the vagina. And then a grade 4 is when it's all hanging out. So grade 1 is mild, grade 2 about a moderate at the opening to the vagina, grade 3 when it's exposed outside the vagina, and then grade 4 when it's all the way out. Thankfully, there are many safe and effective solutions nowadays to help women improve their comfort, quality of life, confidence, and one of those options is pelvic floor physical therapy. When the prolapse is mild, meaning a grade 1, the prolapse hasn't gotten to the opening to the vagina yet. Women don't necessarily feel a bulge, but they feel pressure. They may feel low back pain, difficulty starting to empty bladder or bowel. The pelvic floor physical therapy, getting the pelvic floor or Kegel muscles stronger, can actually help to relieve some symptoms. It may actually prevent the prolapse from getting getting worse. The best time to do these exercises is in between children when they're younger and the tissues still respond well. And some women may actually resolve their symptoms and resolve the prolapse, which is really, really effective. Seeing a pelvic floor physical therapist, well-trained clinicians once a week for about an hour or on average over the course of a 2-3 month period where they'll devise a program to help strengthen your pelvic floor muscles, see other areas improvement, and improve a woman's comfort level. Another option is something called a pessary. And a pessary is a ring-like device made of silicone that is fitted in the vagina, and it helps to support the organs back and push them back up into their normal position. When it's the right size for a woman, she shouldn't see it or feel it. It should not be too big that it hurts. It shouldn't be too small that it falls out, just the right fit. And an example of a type of pessary is something like here. Now, this is a pessary that's placed inside. This is a ring pessary, and it's fitted in the vagina, helps to push up the organs. In this case would be the uterus. In this situation, a woman who has a uterine prolapse or a vaginal prolapse, where it's at the top of the vagina, that can push the prolapse back up and help to maintain symptoms. Some women can actually also learn how to remove it, clean it, and put it back themselves. Remove it for intercourse, put it back, remove it periodically to keep it clean, to help it keep the vaginal walls healthy, and use that. And then lastly, there's, of course, surgery. Now, for some women, pelvic floor physical therapy is the right option for them. Others, they may not be interested or have the time to invest in physical therapy, or find that maybe that's not the best option for them. The women are interested in the pessary, but some other women may find that the pessary is not ideal for them. And then lastly, yes, there is surgery. No woman wakes up in the morning and says, oh, I want to see a urogynecologist. Oh, I want to have surgery. Thankfully, there are good, safe, and effective surgical solutions for women who have either uterine prolapse or vaginal prolapse that can improve, again, quality of life, confidence, comfort, and that's very possible. These surgeries can be done either vaginally, laparoscopically, robotically, they're minimally invasive. They oftentimes require very little downtime. Again, no incision of the abdomen if it's done vaginally, and can really improve a woman's quality of life. So again, if you're a woman listening to me you've noticed that your uterus has dropped, or the vagina after you've had a hysterectomy in the past, you've noticed that now there's a bulge, and that could be a vaginal drop or vaginal prolapse, know that you don't have to live or put up with it. They're good, safe, and effective solutions to improve your quality of life. And if you have a woman in your life who will benefit from this, and if you're not subscribed to my YouTube channel, please do subscribe. Do like and share this video, and she'll be so thankful for that. And if you're a woman who suspects that you have a uterine prolapse, or you've had a hysterectomy in the past and you suspect you may have a vaginal prolapse after listening to this video, and you're looking for a board-certified, fellowship-trained urogynecologist with the experience, expertise, who's going to listen to you, evaluate it, and get to the bottom of it and help you solve this condition. So if you're a woman who's listening to me and you suspect you have a uterine prolapse or a vaginal prolapse, know that you don't have to live or put up with it. If you are looking for a board-certified, fellowship-trained urogynecologist with the experience, expertise, who's going to listen and get to the bottom of it and fix it, I invite you to work with me. Well, one of two ways you can reach me is through my website, which is www.drtugbiyele.com. That's Tugbiyele.com. Or you can reach me through my office by calling the number 470-325-1280. Imagine how you'll feel when you no longer have to deal with that prolapse, that pressure, that low back discomfort, the constipation that is due to the prolapse, the discomfort. You'll be able to go back to doing the things you enjoy, exercising. Intercourse becomes more comfortable because the prolapse is not in the way. All these things are possible for you when you work with me. So I invite you to work with me. I look forward to seeing you in the next video.